From the Leeds Grenville Lanark District Health Unit, I'm talking with the Dr. Paula Stewart. She is the medical officer of health there. So let's talk about COVID and get an update, as well as all other things that are happening out there. So Dr. Stewart, how are you?
Good. Yeah, it's a nice summer day.
It is indeed. It is. So what is the status of COVID-19 here in Leeds, Grenville, and Lanark?
Yeah, like the rest of the province, we have had an increase in new infections that have been confirmed with the lab. And remember, it's only the people who are eligible to get the PCR lab test that we know about. But that gives us a sense about what's happening in the community. So for the last 2 to 3 weeks, we've seen an increase in the number of new infections. And I think that the main reason for that twofold. One is that people are out and about more. They're socializing more. And that leads to an increased risk of transmission. At the same time, our lovely Omicron virus has decided to change yet again. I think we're on like the 5th or the 6th, right? So we had BA 1.1 and then we had BA 2.1.12.1, and we're now at BA 4 and BA 5. And they just change enough that if you've had a previous infection with BA2 and then get B4 and 5, the body says, oh, this is different, and decides it has to mount a new immune response to it rather than just building on the immune response it had before. Yes. So for people who've had a COVID infection earlier, say a month or 2 or 3 ago, 5 or 6 months ago, then if they're exposed to the new BA 4 or 5 is the dominant one, then they can have a new infection. And they're surprised at that because they thought that with one they would have the antibodies. So it's a combination of people being out and about more, socializing more, and we've got a new variant that's a new subvariant. It's still Omicron.
Yes.
So it's still the wide range of symptoms from the runny nose, the headache, they're not feeling well, all the way to people being really sick with pneumonia, particularly if they have underlying health conditions. So that's the same. The vaccine response is very similar. It's about 40% protection within the first 6 months of having actually developing symptoms, and then probably about 80 to 90% in terms of serious disease. So the vaccine is the same. What's changed is our body's reaction to the new Omicron subvariant means that we may get COVID more than once.
Yes. Okay. Alrighty. So now, having talked about getting the different doses, now we are really at the 4th dose, right? People are now going for the 4th dose?
Yeah, it's a really good question. So it's very clear that the basic series that you need to get good protection is 3. Okay, so you need the first one, 2 months later, the second one, and then 3 to 5 months later, you need the third one. That's the basic. Everyone should have that. Over the age of 60, we have like 70, 80, 90% of people who are protected. Not so much the under 50s. So really encouraging the under 50s, if you haven't had your 3rd dose, please go and get it, because that really completes it. That gives the good protection that you can get from the vaccine. Okay. And then the province recognized that at the start of Omicron and back in sort of January, February, that it would be good to boost the people who were most at risk of having really serious disease. And so that's the 60 plus, and that's absolutely has played out in terms of people being hospitalized or deaths. It's that age group. So they were able to get the 4th dose 5 months after they had their 3rd dose.
Yes.
And then just today, so your timing is perfect, just today, the province has opened up eligibility for that 4th dose to anyone 18 and plus who would like to get it. Okay. And it's an individual decision. The groups that could really benefit from it, and I had people emailing me and asking me about it, are the people who have COPD, chronic pulmonary disease, congestive heart failure. They're in their 40s, 50s, and 60s, 40s and 50s, and they're saying they want to have a boost in their immune response as well. So that's the group that I think could really benefit from it now.
Okay.
and it's an individual choice. If you're 18 or older, you can choose to have the 4th dose. So I think people who have chronic health conditions could really benefit. It just gives an extra little push on the immune response that you already have. Or people, say, who live with someone who's immune compromised and they really don't want to make sure they would transmit it to someone. So it's an individual decision.
Yes.
People will be able to come to our clinics. If you're not sure, talk to your healthcare provider. So that's what's changed as of today.
Thank you for that explanation. Is there a 5th dose out there? There is
So actually, people who are immune compromised are already able to get their 5th dose because their primary series is 3 doses, not just 2.
Okay.
So whereas most of us would get a 3rd or 4th dose now, they could actually get the 5th. But you're probably talking more about the fall. And so we are expecting that we will be offering the vaccine to everyone, whether it's the 12 or the 18 plus. We will expect there will be a vaccine in the fall. We are really hoping that it's going to be bivariant, so it'll have two encoding of the spike protein. You know how the messenger RNA in the vaccine gets into your cells, it produces that little spike protein, and as soon as it's produced, the body says, "Oh, I don't like that," and produces antibodies. Well, this new one is going to have both the old spike protein and the Omicron spike protein, which is a little bit different.
Good.
So we're hoping that that's really going to boost the response to the Omicron virus. Still being researched right now, data being looked at, but that's our hope. So that, and we're expecting that there probably will be, just like with the initial vaccine, there'll be less supply initially, so it would be more likely the 60 plus group, the immune compromised people, and then hopefully others. So that's the plan for the fall, that people will be able to get another boost. So either your 3rd, 4th, or 5th, depending on what you've already had.
Exactly.
It will help you then through the winter when we really expect that we're going to have more circulating COVID and influenza and RSV, all the usual kinds of. So that's the plan. Stay tuned.
Stay tuned. Okay, so anybody who has already had their 3rd, they should go for the 4th now. They really should go for it.
It's a really individual decision. It's if you have chronic underlying health conditions, if you have close contact with someone with the immune, because the basic 3 gives you good protection. And so it's people who really could benefit from a little boost right now.
Yes. Now, what about people that are in long-term care homes? How are they looking right now? Are they they've had their different doses?
They've already had their 4th.
Yes. So are we finding that the cases are not as rampant as they are somewhere else?
Yeah, it's absolutely wonderful that if sometimes, because people come in, a visitor could bring COVID in and give it to someone.
Yes.
That being said, though, that it's not, people aren't really sick with it. When they have those 4 doses of vaccine, they're coping well with the virus, which is exactly what we want.
Yes.
So we do have, not very many, but we have a little bit of spread in some of the homes. And the vaccine is really making a huge difference. So we're thrilled about that.
One question for you, the monkeypox.
Yes.
I hear that we have it in our area.
I wouldn't say we have it in our area. I would say we have someone with it in our area, which is really, really different, because monkeypox and COVID could not be more different. Monkeypox virus is an infection of the skin, basically, and it's lesions in the skin itself, and it's spread by close contact with someone with a lesion. So it's really, really different. Not surprising that we wouldn't have people here who've been exposed elsewhere and live here. That's entirely possible. We have really good information up on our website. So if people want to learn more, just when their little search bar comes up, do monkeypox, and it'll take you to a really good fact sheet that links directly into the problem. Their fact sheet that has a Q&A. It's very, very good.
Good.
It's basically a virus that is spread by close contact with a lesion, and the symptoms can start with a prodrome of a headache, a cough, fever, mild, muscle aches, not feeling well,
Yes.
and then the lesions come up. They're very characteristic. And so if anyone is concerned, they should contact their healthcare provider. We've given them lots of information too. And we have a vaccine for close contacts so that we can provide them with some protection. So
awesome. So now the assessment center is located where? Is it still at the Y, or is that where you get your vaccination?
So actually it was in the Y, but we moved it to one of the churches.
Okay.
And people should go and check on our website to find exactly which one and where it is. The Y just wasn't big enough for us to do some of the clinics.
Okay.
So that's working well. So if you're interested in getting the vaccine, go to www.healthunit.org, type in the search COVID vaccine. They'll take you right to the page where you can actually book the vaccine. You can find out about the vaccine, where you can have it, and in the booking system actually gives you a choice about where you might want to go and get it.
Awesome.
So that's, if you're interested, please, that's the best way to go. We are still accepting walk-ins at the clinics to make it easy for people who would rather just drop in.
Yes.
And as long as we have vaccine and we have nurses to give it, we will give it to walk-ins, but obviously preferences for people who have appointments. But so go to the website, book an appointment if you're interested. For sure, those people who have not yet had their third, they need to be going to the website.
Yes, definitely. I agree with you. Dr. Stewart, it's been an absolute pleasure for Matthew and I to be able to talk to you. You've been very gracious to us in the last 2 years, talking about COVID-19. Anytime that we wanted to talk to you, you were there. So we do thank you for that. All the best on a happy retirement.
Thank you. I've really enjoyed these conversations as well and really appreciate how you spread the message. So thank you. And I will.